Good morning from the 17 studios. I'm Alex Fisher. We are breaking into regularly scheduled programming to bring you the latest on the coronavirus crisis here in Kern County. Normally, we have a press briefing from our county officials once a week held on Thursdays. However, Governor Gavin Newsom announced new guidelines for reopening the state on Friday, and our county officials are announcing those new guidelines and how they're going to affect us in Kern County today. Let's turn things over to our county officials. This is Megan Pearson, the Chief Communications Officer for Kern County. Let's listen in.
Substantial change from what we'd seen before and required a lot of investigation to understand how it will impact Kern County. We understand there are a lot of questions, and we're here to help you answer those today. So this morning, our Director of Public Health, Matt Constantine, will discuss where we stand today on the metrics, and our Chief Administrative Officer, Ryan Alsop, will walk through the changes that the Governor made on Friday in detail. So with that, I will bring up Matt Constantine, our Director of Public Health.
Thank you, Megan. Good morning. This morning we are announcing 94 new cases in Kern County residents and thankfully no additional deaths. We're going to spend our time talking about the new state metrics and how this impacts businesses, but I want to mention that we are going to talk very thoroughly about our skilled nursing facilities at the board meeting tomorrow morning. So just a few comments on the numbers, and then I'll turn it over to Ryan to talk a little bit about some of the business implications. As Megan indicated, the governor made some significant changes to what was previously called the county data monitoring list. They have made some changes now so that previously we were measuring multiple different metrics. Now we are just measuring two metrics: the percent positivity and the case rate, which were two previously measured metrics, but now just those two we are now measuring. Percent positivity will be averaged over 7 days with a 7-day lag. And the case rate now is changing though a little bit. So we're actually tracking the average number of new daily cases averaged over 7 days with a 7-day lag. The state has indicated that they will run this analysis only once a week, every Tuesday. However, we believe we can calculate what today's numbers would be. The percent positivity, we believe, is just over 10%. Again, the state wants us at 8% or below, so that number has come down quite a bit. We're getting much closer to meeting it. And the case rate, previously, this was measured over 14 days. Now it's an average number of new daily cases averaged over 7 days. We believe our rate is right around 13.4. So we're still higher than they want us to be, but that number has come down. So we are trending down over the last couple weeks, which is good news. It's important to note that although we are meeting that highest tier, what they now call the purple tier, in order for us to move to the less restrictive tier, which is the red tier or tier 2, we would need to meet those new criteria for 14 consecutive days for both metrics. It's important to say that. So 14 days that we would have to adhere to the new numbers for both of those criteria. All of this is now clearly on the state's website at covid19.ca.gov. It explains it in a more thorough way, and it is a logical explanation that you can follow along with the different tiers. With that, I'm going to turn it over to Ryan to talk somewhat about the businesses.
Good morning. We do not have our sign language interpreters here today. I think Megan will be covering that here in a second, but we'll include sign language interpretation in post-production and get it out so that that can be viewed. On Friday last week, Governor Newsom announced his administration's new plan and framework for reopening the economy and the state's economy more broadly. This plan is called the Blueprint for a Safer Economy and replaces the previous county data monitoring list for determining what businesses can and cannot reopen, which we've spoken about quite a bit over the last several months. The governor has stated that this new blueprint incorporates what we've learned as a state, what his administration has learned in dealing with COVID-19 to this point, and that the changes that he announced is the next evolution of his administration's response to COVID-19. Importantly, even under this new framework, it's important to point out that Governor Newsom and state public health officials are determining for all of us which data we should be monitoring, which data is most important to monitor. Matt discussed and pointed out we're now monitoring number of daily cases and the percentage of positive tests related to this new plan. He's also determining which businesses and activities can open and which businesses and activities are to remain closed. That said, this new framework specifically ties a county's local numbers on new cases and testing positivity rate to specifically when and how business activity in a county may resume, which is clarity, frankly, that Kern and other counties have been seeking for months. For the first time, Kern County residents, along with the rest of California, have a single online source to look up whether a business or an activity is being allowed where they live. And you can get that information. It's easy to navigate. They've done a good job in getting their website squared away. That's at covid19.ca.gov. Again, if you have any questions about anything that I'm about to talk about, you can get those and follow up at that website, covid19.ca.gov. So while we now have some clarity, and while Kern County businesses have a way to plan for reopening going forward, the changes the governor made last week have made reopening and certainly to more normal levels for most indoor business activities a slow and stringent process. Every county in California has been assigned to one of 4 tiers based on its rate of new cases and positivity. At a minimum, counties must remain in a tier for at least 3 weeks before moving forward into the next tier. The state has said, the governor said Friday, that data will be reviewed weekly by his administration, and tiers will be updated every Tuesday. So on Tuesdays going forward, every Tuesday is when the status of counties in these tiers will be updated. So to move forward, a county must meet the next tier's criteria for a 3-week period. If a county's metrics worsen for 2 consecutive weeks, it will be assigned a more restrictive tier. So there are 4 tiers. They're color-coded. I'm going to walk through them now. I'm sorry in advance. This is a lot of detail, but we think it's important for you to hear. The worst tier, to just speak frankly, the bottom tier is represented in purple, and it's called widespread to be reflective of the fact that the virus is spreading and is widespread throughout that particular county. In counties in this tier, they have more than 7 new daily cases per 100,000 people and a testing positivity rate that is higher than 8%. 38 counties in this state are in this purple tier, the widespread tier. That represents about 87% of the state's entire population. Kern County is in this tier. In this tier, the governor announced Friday, indoor retail, shopping centers, and malls are open with capacity limited to 25%, along with other restrictions. He talked about, or the state websites makes reference to shopping malls where food courts need to remain closed, or public spaces within those shopping malls still needing to remain closed. But again, 25% capacity for indoor shopping mall operation. We were also pleased to hear him announce that hair salons and barbershops can open indoor operations with restrictions, of course, adaptations, operating under state guidelines. This is an industry of people who have been hard hit, in addition to others, by this pandemic. And we were pleased to see that the governor is allowing those business operations to move indoors while being safe, adhering to guidance with adaptations, et cetera. For those of you who have asked in the nail salon business, under the governor's announcement Friday, nail salons are closed. They are closed for all indoor operations. That is the decision made by the state. Gyms and fitness centers remain closed in purple in Kern County in the widespread category for all indoor operations. They can be operating outdoors. Restaurants remain closed for indoor dining. Restaurants are to operate outdoors where they can, following guidance, pickup, delivery, etc. Bars are closed for both indoor and outdoor service here in Kern County and throughout California, where counties are in the purple tier. Schools in this category, purple, widespread, they are not permitted to reopen for in-person instruction unless they receive a waiver from our local health department that must also be approved by the state of California. We have talked about this. That waiver process stays in place for Kern County, and this is for TK through 6th grades only. The next tier is this called substantial. It is represented by the red color. Kern County is currently working to move into this tier. To move into this tier, our numbers must hit 4 to 7 daily new cases per 100,000 people. We have to be there for 3 consecutive weeks in order to move in. Testing positivity rate needs to be between 5 and 8%. In this tier, and I'm walking through this in detail to give you a sense of what we're working toward and what you can help us work toward. It is not the best of circumstances, but it is a framework to allow for more business activity to resume. In this tier, the red tier, the substantial tier, salons, nail salons, can resume indoor operations with restrictions, with adaptations, operating under state public health guidance. Restaurants can begin indoor dining at 25% capacity. Again, that's not ideal, but if you are a restaurant owner, you are operating and doing what you can on all the other sides of your business, outdoor dining, take home, delivery, etc. Being able to open up to at least 25% capacity indoor for indoor dining, I think is important. It's better than zero. Bars, obviously where bars aren't providing meals, they're still closed under this next tier per the governor. Gyms can begin indoor operations at just 10% capacity once we move into the next tier. And churches, there's lots of questions and conversations about religious services. Churches may operate indoors at 25% capacity or 100 people, whichever is fewer, under the red tier, the substantial tier, the tier that we are working to move into currently. Under the red tier, and I think this is an important note and point to make, schools can reopen for in-person instruction once the county has been in this substantial red tier for at least 2 weeks. So once we hit the numbers, we're in purple, we're hitting red numbers. We keep those red numbers for 3 weeks. Once the state officially moves us into that red category, we must stay in that red category, hitting those numbers for an additional 2 weeks. If that is achieved, the state is allowing schools in Kern County to reopen for in-person instruction. That is a bit of good news, and obviously there's a set of guidance that goes along with that schools must be adhering to. Again, you can find all of this information on the state's website. The last 2 tiers, I'm going to hit on them real quick. Once you go through red, you get into the moderate spread identified by the orange color. This allows for even wider opening of indoor operations. Counties in this tier have to be at a 1 to 4 daily new cases per 100,000 people and a 2 to 5% testing positivity rate. Given where we are quite a long ways away from hitting and being able to get into the orange tier, likely months. But nonetheless, it's important to walk through what this tier is. Restaurants in this tier can open indoor dining wider to 50% capacity. Bars not serving food, those bars can open outdoor operations only. Again, currently they're closed down for indoor and outdoor. Bars can begin to open outdoor operations. Gyms in the moderate orange category can open indoor operations wider to 25% capacity, along with gyms that have indoor pools, et cetera. Those pools, those activities can resume. And then finally, minimal yellow, which we are very, very far away from. It's going to take considerable work. Today, about 0.1% of all counties in the state are in this tier. You must only have 1 or fewer daily cases, new cases per 100,000 people, and less than 2% testing positivity rate. Even in the minimal yellow tier, which is the best tier that you can be in under the governor's current framework, a restaurant can open indoor dining. They will do so, however, operating under adaptations and restrictions and guidance, given the virus continuing to be here in Kern County. But you can begin reopening indoors for indoor dining. Bars can begin to move indoors and open indoor operations up to 50% capacity. Gyms can begin moving indoors up to 50% capacity, with spas and saunas and steam rooms and those things opening in gyms. Family centers, arcades, things like bowling alleys, those sorts of places can open at 50% capacity, and churches, lastly, 50% capacity. I point this out again to emphasize that this framework will be applied in a way that makes reopening slow and stringent. This is the governor emphasized this point on Friday. Even in the minimal yellow category, it is not back to business and business as usual. We are still operating under some fairly strict adaptations and guidelines for all industries. We're continuing to practice all the protocols that people have been put in place to keep employees and the public safe. But even then, it is not a return to normal for industries like bars, gyms, family centers, churches. There are others. It is not a return to normal. And that category, again, minimal yellow category, is far off, and we've got a lot of work to do to get into that category. But nonetheless, it's listed, and the governor has outlined which activities may resume in that category. So again, it's a slow and stringent process. No matter what the tier, operating under adaptations and guidelines. And I do want to say that we could be back and dialed back at any time if we don't meet and sustain meeting the metrics in any one of these tiers. So it's very important that we all together come together to help slow the spread, to do everything that we can, washing hands, distancing, et cetera, to slow this spread down so that we can move into higher tiers. And lastly, there could certainly be future changes for the better or worse by the state. We're getting into fall and flu season, depending on how this pandemic proceeds, where we are as a state, as a county. All of the governor has said that he could announce changes. Again, those changes could be beneficial. He could come out and announce and add certain reopening activities, ahead of counties moving through tiers. He certainly has that authority to do that, but he could also come out and make some directives and provide some orders that have a detrimental impact on reopening and slow it even further. So I think it's important to say that to everybody. This is the world we're living in currently. Again, the state is calling the shots and managing all of this. Again, questions, you can go to covid19.ca.gov to get details on this. If you're a business owner here, you simply type in Kern County, type in your business, and you not only can see what the status is for your business, how you should be operating, but there is a link to some detailed guidance on how, if you are operating, how you should be, if you are not, and you soon may be, how once you're able, how you should be operating once you're able to, once we hit some elevated tiers. So sorry for all that detail. I know it's a little bit boring, but I think it's important to point out. And with that, we're happy to get into any questions that you might have.
Thank you, Ryan. Okay, we'll go through a similar process that we do on Thursdays. I want to remind all of our media outlets, again, that today we're going to keep our questions to this particular subject. I know there are a lot of other questions, and Michelle and I are always available to help you work through those stories. So if you have questions related to this announcement, we're happy to answer those today. Remember, it's *6 to unmute. We'll call your outlet. Please ask your initial question only. And if you have follow-ups, once everybody's had an opportunity to ask their first question, we'll come back in and open it up again. So at the top of the list going down, we have Bakersfield, California, and I believe we have Stacy on the line.
Yes, thanks, Stacy. I wondered, does create any new restrictions for retail shops or other sectors? Or do they need to limit their, traffic in the store to a certain percentage of capacity or anything like that? And has any of the guidance significantly changed for any of the industry sectors, or is it still pretty much the same that had been previously issued?
So, Stacy, I believe the answer is that the guidance generally remains the same. The guidance documents have not changed for the industry sectors. If you go on the state's website, what you'll find is that for those in the purple section, the widespread tier, retail locations are allowed to operate with modifications, and they're at 25%. And now that's going to be different for several of the sectors. So what I would encourage you, if you have a specific sector in mind, to visit that site, because they're going to be different for several of them. But the guidance documents in general have not changed.
Okay, thank you.
Mm-hmm. Our next outlet is Kern Radio. I believe we have JR on the line.
Yes, good morning, JR from Kern Radio. My question is there any sense of urgency considering our numbers are more than double of where they need to be to get to the next tier? Is there anything that the county is going to do that we are already not doing to help mitigate the spread and bring those numbers down? Maybe more enforcement or anything along those lines?
We'll have Matt respond to your question, JR.
JR, good morning. So what we have seen over the last couple weeks are the daily number of cases we're reporting has come down. We're hopeful that over a period of time, when the state averages those out, we'll see that average daily case rate continue to decline. Although we're grateful that those numbers are coming down, we're concerned that they potentially could go back up. So I think it's important to remember that we need to do everything we can to drive those numbers down. The new state system, though, now puts us in charge of our own destiny, which is good. So our actions, our abilities to bring those numbers down even further will result in other businesses being open. I was talking to a business owner this morning, and they specifically said that they're actually observing more customers coming into the business that aren't wearing masks because the numbers have been lower. But as you just said, JR, I think this is a reminder that we need to continue the effort, because if we can move those numbers down further, that impacts our ability to open up businesses. And it's a good reminder, you're wearing a mask when you go into that business to protect those employees and those other customers. They may not have the ability to stay home when they're sick, or they may be caring for a loved one that is ill. They can't be sick. So by wearing that mask, you're protecting that essential worker. So JR, hopefully that addresses your question.
No. So you guys don't plan on doing anything more than what we have already been doing, though?
JR, our position remains the same. We're going to continue the efforts, going to continue responding to complaints that we get. We will continue to refer complaints to the strike team through the state, but our efforts remain the same.
Okay, thank you.
Our next outlet is Channel 23. I believe we have Mike on the line.
Hello, yes. Megan, can you hear me?
We can. Go ahead.
I was just kind of touching, if I could, on the end of JR's question, and I was curious that you had mentioned that the numbers need to improve over that 3-week period. I was curious, if we miss 1 day or 2 days and the number spikes back up but goes back down, do we have to go back to day 1 and start all over again? And I know that some private schools have been in-person learning for about 2 weeks now. Have you gotten any reports of anyone testing positive at any of these schools? Thank you.
Mike, we're going to have Matt respond to that.
Mike, good morning. In order for us to reach that next tier, as Ryan discussed, we have to achieve those metrics for 14 consecutive days. So yes, if we missed one of the days, we start the clock over again. So it has to be in a row. And yes, we have had, I think we're up to now 3 schools that the county has approved and the state has approved to reopen. These are small schools. These are very small schools, maybe somewhere between 20 and 50 total enrollment. The protocols that they have put in place that we have approved are significant, and I think will preclude the ability for COVID to be transmitted as long as those procedures are followed. So as we've said before, we do not see that current environment as a risk. Most of what we see are small family gatherings that tend to cause more of those contacts and those outbreaks. Does that answer your question, Mike?
Yes, to a point. And when you mentioned the monitoring case rates over a 7-day period, is that real-time results, and are we getting them real-time?
So for both positivity rate and case rate, they look at 7 days worth of data, but they have a 7-day lag. So those numbers are delayed quite a bit and then averaged. So the state has promised us the ability to mirror their calculations so that we could know exactly the number and calculate it the same way. We're still working through the details. We think we'll be able to do that. We need to wait until tomorrow to see what the numbers are, to see if we've matched their math. But hopefully, yes, we can track it perfectly.
All right, thanks.
Thank you.
Our next outlet is Kern Soul. I believe we have Elizabeth on the line.
Hi, good morning. My question today, I just have a clarification question, so I'm sorry for asking this again when we've already gone over it. I'm just a little confused. So I'm confused because you threw out, you have to maintain those metrics for 14 consecutive days to move on to the next tier, but then there was a 3-week time period too where you had to be in a tier for 3 weeks. Is that correct?
Correct. So you are in each tier for 21 days. It takes 14 consecutive days to move to the next tier.
Okay.
Do you want me to explain that again? I just realized that might not have been very clear. So you are in each of the tiers for 21 days regardless. To achieve the move to the next tier below you, you have to achieve 14 consecutive days of the next tier's metrics.
Okay. So if you achieved the metrics, the first 14 days of those 3 weeks, you still have to wait 1 more week to move on to the next tier. Is that right?
Correct.
Okay. Got it. Okay. Thank you.
You're welcome. Our next outlet is Mojave Desert News. Anyone on the line?
Hi, this is Jeff Arnold from the Mojave Desert News.
Hi, go
I
ahead.
had a question regarding how this would affect libraries.
So we'll have Ryan respond to your question.
So the governor announced Friday that, in addition to shopping malls and retail establishments, hair salons, barbershops, that libraries can resume indoor activity at 25% capacity. So that means our libraries here in Kern County can resume 25% capacity, and this is going to be something that we'll work with our libraries on to make sure that we've got, and they have, protocols in place and a way to manage this in a way that complies with the state guidance so that it's managed accordingly and that the public is kept safe, the county employees are kept safe. We've got cleaning protocols in place, et cetera. So all of that stuff will be worked through with our library staff. But good news is that the libraries can open at 25 limited capacity going forward under the tier we're currently in.
So will a time frame still be developed?
I'm sorry, say that again?
So a time frame, is it currently being developed, or is it something that you're working on?
We're working on those. We're having those discussions now.
All right, thank you.
Mm-hmm. Okay, our next outlet, do we have anyone from the Mountain Enterprise on the line? Okay, our next outlet is Valley Public Radio. Carrie?
Hi, good morning. Can you hear me?
We can, go ahead.
Okay, good. Okay, I wanted to follow up on what Stacy had asked earlier. So she had asked if there were any major sector changes. I had thought that one major one was actually the salons opening, correct? Or at least being able to open the doors with modifications. That had not happened before this week. And then just the second part of that was when there are industry or sector changes, does that require another local health order from Kern County? Do you guys need to put out a health order to approve of things opening up with modifications? Or is it just that if the governor approves it, then they're approved countywide as well?
So for your first question about hair salons and barbershops, those can open currently with modifications. And that was a change. So that was a new announcement that the governor made on Friday. Give me your second question again.
Yeah, I'm just wondering if there needs to be a local confirmation of like a local health order to confirm that businesses are opening like hair salons if there's a new change to a certain sector, or if the governor approving it is all that's needed.
Correct. If the governor approves it, that's all that's needed.
Okay, thank you.
Our next outlet is Channel 29. I believe we have Emily on the line. And it's *6 to unmute. Okay, our next outlet is Channel 17. I believe we have Karen on the line.
Hi, good morning. Karen here. I was wondering, from a public health standpoint, what is sort of the difference in between hair and nail salons in terms of the ability to spread? I think a few salon owners have been curious why hair salons have a little bit more leniency in the lower tier than nail salons, which are allowed to open in the next red tier.
Karen, we're going to have Matt. No, sorry. We're going to have Ryan respond to your question.
Okay.
Karen, we don't know. I don't know how else to say it. We just don't. These are announcements that are coming down from the state. It's their public health team. The governor's making these announcements. I don't personally understand why hair and hair salons and barbershops may resume indoor activities. Obviously, they've got a set of guidance. I don't understand why nail salons can't do the same. Seems to me that there are a variety of protocols that nail salons have put in place that are effective and in separating people from one another. Public health best practices. I don't know, but we're encouraged by the fact that they are allowed to resume, given the fact that they haven't been able to open. Encouraged by the fact that the governor is allowing that activity to resume as soon as we get into the red tier, and so I think we're happy about that. But I can't answer your question about the thinking that's gone into to that.
Okay, understood. Thank you so much.
Our next outlet is Telemundo. I believe we have Norma on the line.
Good morning, everyone. Can you please talk and expand about the Latino COVID-19 task force? And this looks like it'll be a long-term or maybe permanent commitment. Can you please talk about it?
Matt's going to respond to your question, Norma.
Norma, thank you for asking that question, and I know you've been an integral part. I really appreciate that. So, in fact, as you know, we have another meeting today to talk about how we can actually align and start on our progress. But the Latino COVID Task Force is a collaborative effort, as you know, spearheaded by Jay Tamsey at the Kern County Hispanic Chamber of Commerce, and it brings together some real experts and some ability to focus on the disproportionate numbers of how COVID affects our Latino community versus the other parts of our community. So we have developed a kind of a plan of action that we're going to hopefully finalize. And the idea here is that we have several different approaches to try to change these metrics to provide better awareness and education, better testing, better access to resources for those that are affected disproportionately. The county public health is intending to fund this activity. And this is a good model for how we're going to address COVID-19, and not for today, but for tomorrow and going forward. And also, as you make reference to, presents a terrific model as we look at other diseases and how it disproportionately affects the Latino community. Norma, does that help address your question?
Yes, it does. Is there anything that you believe it's important? Why do you believe that a committee like this will make a difference and should help out bring the numbers down and hopefully, go back to normal little by little? It should help out.
So I'm not quite sure of your question, but I think what we need to do is make everybody aware that COVID numbers are higher in our Latino populations, and so we need to do more. And but this is what we do well. This is why we exist, where local leaders can get together in a moment's notice. And as you know, we have some very important, influential, long-term members of our community that are dedicating their time, their own time and resources, from lawyers and doctors and community leaders, to pull together to figure out what are we going to do differently. And I'm convinced that you'll see changes, that you'll see numbers change as we identify the issue and we pull together and we figure out ways to solve it together as a community. This is what Kern does really well.
Okay, thank you so much.
Okay, that was all of our outlets. So I'm going to go back up to the top and just burn through the list one more time to see if you have any follow-up questions. Remember, it's *6 to unmute. So starting at the top of Bakersfield, California. And Stacy, did you have any follow-ups?
Hi, yes. I was wondering if hair salons are allowed to open. A lot of them offer other services like manicures and pedicures, the stuff that nail salons do. Are hair salons allowed to, to conduct those kinds of services, or is there some specific language that says it's only for the purpose of cutting hair?
Yeah, they are not allowed to offer those additional services. Does that answer your question? Okay, we're going to go to the next outlet. Stacy, if we lost you, we can come back later. Our next outlet.
Oh, I'm sorry. Did you not hear me?
No, we did not. Go ahead.
Oh, gosh, I'm sorry. I'm sorry. My question was, a lot of hair salons also offer nail services.
Stacey, I'm going to stop because we did actually hear that part. I'm afraid maybe you didn't hear our response. So the answer is...
Oh, I apologize.
Yeah, they cannot offer those additional services. A hair salon can offer hair services, and that's it.
Okay, thank you.
Our next outlet is Kern Radio. Any follow-up questions?
No, Megan, thank you.
Our next outlet is Channel 23. Mike, any follow-ups?
Yes, Megan. Real quick, I was just curious, when you talk about the positivity rate and the people who are trying to maintain it below that thing so we can move up, if I understand this correctly, people who come in contact with people who might have symptoms are being told not to get tested. So what is the likelihood of that percentage getting down to a rate where we can move to another level of the color if, the people that we're testing, do you see where I'm going with this? If they only have symptoms or they're only, that kind of a positive, it would seem that the number of results would always be higher as far as the positivity rate. Does that make sense?
I think so. Mike, we're going to have Kim Hernandez respond to your question.
Okay.
Give us just 1 second.
Hi, Mike. Good morning. To clarify, as we discussed last Thursday, currently in California there are 4 tiers for testing. Currently, testing of persons who have been in close contact with a confirmed case is in Tier 2. So it is still recommended in California that if you have been in close contact within 6 feet for 15 minutes or more of a person who is known to have COVID-19, then you are recommended to talk to your healthcare provider, be assessed, and are likely going to be referred for testing. So we just wanted to make that clear in our community that because testing continues to be widely available in Kern County, we are testing all tiers of people in following the state's testing guidance, so that testing is available for all people, and that there are higher priorities if testing is to become more restrictive, or if we have difficulties with testing turnaround time. Currently, that is not the case, so testing is widely available. It is still recommended in California that if you are a close contact to a known COVID-19 case, that you do seek out testing, that even if you choose not to seek out testing, that you do quarantine at home for those 14 days from your last exposure to that positive case. That exists outside of testing as well, that people still need to quarantine and remove themselves from others while they watch for symptoms in case they also come down with COVID.
Okay, Kim, thank you for that. And I was just wondering, while I have there, is there any latest on tracking cases in Kern County? And what have you assessed so far? Have you determined any hot spots in the past? And is there any update on the status of releasing ages of the fatalities?
So, Mike, let me make sure I can clarify your question, because it sounds like there's two parts to it. So the first one is, have we identified any trends as we go through the tracing? And then the second one is, do we have an update on the ability to release ages related to deaths? Did I catch that right?
Yes.
Okay. We're going to have Kim respond to your questions.
Hi, Mike. For the first question regarding hotspots in our community, we continue to see cases throughout Kern County. With a large proportion of our cases, most of them are close contacts to a known case. We continue to see a lot of cases occur within the same household or with personal gatherings. And so we know that that is a big piece of it. We know that in general, as we talk to our patients, that a lot of them see that as a lower risk activity, not realizing that with your family members or close friends, that you may be going and visiting them without your mask, you may be hugging, you may be having long dinners with them and spending much more time with them than you do out in our community. And so we do know that we have concerns, and we encourage people to limit their contact with everyone outside of their household to avoid introducing it to your household. Once it gets into a household, it's very common because of close quarters, of shared meals and things like that that happen in your household, that multiple people in your household become positive. So we want people to be careful and avoid introducing it into their home and take all of the precautions when they're out in the community. The second question regarding more details about deaths, as you know, the county again is working with the data statistician that is looking into what parameters and in which methods we may be able to release more information regarding deaths in Kern County. We have not received our guidance back yet, so we're continuing to wait for it. And once it is received and reviewed, we will provide information as appropriate, as appropriately designated by our statistician. Thank you.
All right, Kim, thank you.
Okay, our next outlet is Kern Soul. Elizabeth, did you have any follow-up questions?
Hi, yes, I have a follow-up question. Also, Norma about the Latino Task Force. Matt was saying that, they're hoping to see changes with this task force, and once they identify the issue, does public health officials, do they have any guesses or ideas of why Latinos are disproportionately contracting the virus versus other ethnicities and races?
So we're going to have Kim respond to that question, Elizabeth. Hang on one second.
Hi, Elizabeth. One of the main things to remember in Kern County is that Kern County is more than half Hispanic or Latino, and so that's a large proportion of our community to start with. There are other things that we know, particularly in Hispanic communities, where we tend to have large family sizes, as well as a number of people who intergenerational family sizes, so you may have children and parents and grandparents and larger groups of people. We also know that there are other barriers out there. There's social economic barriers, access to care, that a number of people, many of our communities of color tend to live in our more rural areas and may have limited transportation issues. And so we know there's a number of factors which drive us to want to pay special attention to our Hispanic and Latino population to make sure that we can have as equitable access as possible throughout our community. And so we know that there are a lot of other social and economic factors that play a role, and we always look to those things as how can we work within those parameters to bring access, to bring education, and to enable the same amount of attention to groups that are historically with reduced services. So we want to make sure that we have it as equitable as possible throughout our community, and that we focus in on the needs, and in particular sort of the cultural sensitivities that are around certain communities. So within our Hispanic and Latino community, as well as other communities in our community, we are looking specifically at what their needs are, what they're seeing. We're trying to get feedback from those communities so we can continue to address and support them.
Thank you, Kim. Just to clarify, you said larger family sizes is a factor. Are you saying that there's a larger number of people living within the same household? Is that what you're getting at?
Yes. Sorry, I'm getting feedback from the side, so yes, that's her confirmation.
Okay. Thank you so much.
Our next outlet is Mojave Desert News. Any follow-up questions? Okay, Carrie with Valley Public Radio. Any follow-up questions?
None for me, thanks.
Emily with Channel 29.
Yeah, so, I mean, if we have to stay in each tier for 21 days, I'm wondering if Kern County should expect that we are under some form of restriction, into the beginning of 2021.
So your question is whether or not we as a county should be prepared to be under one tier or another until 2021.
Yeah.
We're going to have Ryan respond.
Hi, yes. That's to answer your question directly. The governor, in his announcement Friday, stated several times, and I wrote it down in quotes listening to him, this is going to be a slow and stringent process for the state and counties within the state and our business community. There are some positive things about some of the changes that were made. There are also some concerning things about some of the changes that were made, but this is going to be a slow and stringent process. Again, 87% of the state's population, 38 counties, Kern's one of them, are in the purple tier, which is the lowest tier, testing having the highest number of daily positives and testing positivity rates. The pathway for purple counties to get to minimal or the yellow is quite a long one. And when you throw in, not only do you have to meet the metrics, you have to demonstrate that you're meeting the metrics for, again, this 21-day consecutive day period in order to move into another tier. And when you do the math on that and all of the uncertainties and everything else in between, this is a long journey, likely. Again, I think that the upside is, or not the upside, but it is likely that we could hear changes made as we go on in the weeks and months ahead to the governor's plan, to this particular framework, some changes in it. He could come out with a new framework in a month or two. So I suspect that will happen. It's also quite possible that there could be announcements made that dial us all back a bit or slow things down even more than they currently are relative to getting into the flu season and where we will be with as a state with COVID numbers in the weeks and months ahead. So to answer your question, yes, 2021 into 2022 likely.
Well, I mean, would there ever be a time where the county would try to push back on the state? Because I mean, I worry that some businesses might just abandon their business if they can't open until January.
We'll have Ryan respond.
Yeah, look, we've been pushing back on the state one way or the other from the start of this pandemic. The understanding that the pandemic's here, it's spreading, it's not going away. We have continually raised issues with the state. This has been super fluid. There's lots of water under the bridge. Frankly, I've forgotten everything we've been doing, but it's been, this is a daily and weekly situation where we're having interaction with the state, and across a number of areas, there have been pushback, not just by Kern County, but many counties in the state, whether it's for clarity, greater clarity, or providing some more detail on expectations, conversations around metrics or testing, et cetera. All of those have been taking place these past many months. I'm certain they'll continue to take place. Kern is not alone in this. There are many other counties that are interacting and engaging with the state. The burden that is on local industry and the business community is significant, severe. They are fighting for their survival. These decisions are quality of life decisions for, in many cases, for these business owners in providing for their own families, the people that work for them, et cetera. This is a very tough situation. So we're happy to get, again, the clarity, some additional clarity from the governor Friday about when and how businesses can open and how they might plan to reopen in some way over the next many weeks and months. But it's going to be a slow process. The fact that Kern controls its own destiny here in some ways, unless the governor changes things again, which I've said he could. Our numbers here locally across those two criteria that Matt has talked about will inform what tier we're in and what businesses are allowed to get open. I want to move into the red category. All I know is the red category is our goal right now. I want to move into that category as quickly as possible, because I know with that move comes a greater opening of economic activity here in Kern. With that move comes getting kids back into school in classroom settings. These are important things that we need to work on as a community. We need everybody's help. There's been talk about, I'm going to go on a little bit of a tangent here if you don't mind, because there have been questions about enforcement, et cetera. We have been engaged and preaching best practices here in this community. The business community themselves, with signage and rules and adaptations and things that they've put in place for customers, for their employees, to keep everybody safe, they are doing a good job. Virtually everywhere I go in this community, there is signage about wearing a mask when you're walking into places where you can't avoid interacting with people. People are wearing them. Hopefully people are washing their hands. I know these businesses have cleaning protocols in place. I think we're doing a good job as a community. The business community is, we're not seeing them as a catalyst to infection rates in this community. Where infections are happening, where positivity rates are going up, is private interactions among family members, somebody getting sick in a household, spreading it to their family members, one of those family members going out and spreading it to another person that they're interacting with. A birthday party where 45 people are invited and nobody's wearing a mask and they're indoors and they're right on top of one another in close proximity for a couple of hours. These are the events that are a catalyst to case spread in this community. Communicating, getting reports on businesses and interacting with the state to convey to those businesses that these are the guidelines that you must have, this is how you should be open, you should be closed, you should have this in place, etc. All of that stuff is happening. But at some point, government's responsibility ends and personal responsibility begins. And we are at that point. People need to be personally responsible for their own public health practices. We need your help. Do all the things that we've been talking about. Be vigilant. Limit your interaction, particularly around groups of people that you're not familiar with, large crowds of people. That's going to provide the biggest benefit. I'm not sure how you enforce gatherings on private property in people's households. I'm not sure we send law enforcement cruising down neighborhoods, seeing some cars and seeing some people go into a house, knocking on that door and ticketing everybody in the house who may not live there. I'm not sure how you do that, or if we want to do that. Again, we've got great controls on the business side. We've got great participation from businesses in this community, talking about best practices, requiring them for people entering. But we need people to be responsible on their own, interacting with their own family, extended family and friends. And to the extent that we can do that successfully, that will be the biggest help in moving our county into the red, getting more businesses open, getting kids back in the classroom safely, responsibly, and putting us on a road to get into the next tier, which is moderate orange. That's the road we're on. We want to do it as quickly as possible. Thank all of you for your help and participation.
Your next outlet is Channel 17. Karen, did you have any follow-up questions?
I'm good, thank you.
Our last outlet is Telemundo. Norma, did you have any follow-up questions?
Yes, I do have a question. And this is basically going back to the restaurants serving outside, okay? We keep seeing, and I sympathize with the restaurants, with every single business that is trying to make a living, following the guidelines and everything, but we keep seeing restaurants that are serving outside, but their spaces are so enclosed. They keep using the shades, and because of the sun, and also because they have fans blowing, obviously the air. But the spaces are so enclosed. They are also using some plastic covers, to avoid the air from the fans, leaving the areas. They keep taking reservations from 6, 8, up to 10 people. And obviously, these are families or friends. They're not sitting 6 feet from each other. And not all of the tables are located at 6 feet distance, one from another. So my question is, why is it considered safer to serve outside than inside? Is it because of the airflow that it's supposed to be less of a risk of people catching the virus from one another? And also, if you are outside and it's very enclosed, you are outside, but the fans are blowing air. And if there's a large group of people or there's several people in the same area, isn't that also a risk, for catching the virus? And a lot of places, do not see it like that. They are just, placing tables and chairs outside and maybe thinking, that they're complying with a requirement, which maybe they are. Are there any specific requirements as to how restaurants should set up for outside service?
Okay, so Norma, I think I actually heard 3 different questions in that, so I want to see if I can capture them, and then we'll have Matt respond. So you're asking about why it's safer to be outside than inside, and if the restaurants have any specific requirements regarding those setups, and I believe there was a question regarding air circulation, so we'll have Matt respond to that.
Thank you.
Hi, Norma. So yes, you're right. The whole purpose of being outdoors is to allow greater airflow between patrons. So we want to make sure we're distancing ourselves at all times, even when we're outdoor. The state has actually come out and said that to be considered outdoor, they want one wall only. So either a top, a covering, and like an awning, or one side of a partition, but they're trying to allow for increased airflow. And of course, we want distancing between patrons. That clearly is demonstrated, as Kim has told us over and over again, to limit the ability for COVID to be transmitted, especially at a time when you're eating. You know, you can't wear a mask that entire time, so you are more susceptible at that time than at any other time. So yes, we are concerned. And if there's businesses that could use some additional support, some more information about the importance, certainly we're here to help, and we can provide that to our restaurant industry. Norma, does that answer your 3 questions?
Yeah, it does, and it does need to be done. And you know, it's our own experience. You know, my husband and I went out to dinner over the weekend, and we asked, you know, for the shades to be, you know, to be pulled up a little bit because it was totally enclosed, and we were told that they couldn't because then it would defeat the purpose of having fans inside. You know, that it would make other people hot and uncomfortable. So I think it's something important that we need to clarify, you know, that the purpose of being outside is, you know, to allow for more airflow.
These are confusing times, and where we're adjusting the way a business operates, and we have guidelines, and now we're supposed to be outdoor, and what does outdoor mean? And so these are confusing times, but we'll work with our businesses, make sure they understand the importance of it, and we can reinforce what is expected. So that's what we do. And if you have a specific location you want us to look at, we're happy to do that. You can call Public Health at 321-3000, and we'll follow up.
Thank you so much.
Thank you, ma'am.
Okay, that was our last outlet. I want to remind everybody watching that if you are looking for specific information about these new tiers, what's open, there is a searchable database on the California website. It is covid-19.ca.gov. And it is all there. You can look up Kern County and then put in the sector that you're interested. I would encourage you to spend some time there. And with that, thank you, and we'll see you next time.
All right, you've been listening to a very long briefing on our county leaders talking about this, the new guidelines set forth by Governor Newsom on Friday to allow certain businesses to reopen. This is transitioning our state from the county monitoring watch list that all of us are very familiar with to this new 4-tiered system that breaks down counties based on the transmission of the virus. That includes the test positivity as well as the number of new cases per 100,000 people. So there are 4 categories that the state is using. Let's just go over those categories really quick. There's, again, 4 tiers. The tier 1 that we are in Kern County, as well as 37 other counties for a total of 38 counties, is considered the widespread tier. And that means that there are more than 7 cases per 100,000 people every single day. And that means that the positivity rate is above 8%. So that is something that we fail when it comes to us here in Kern County. All of us, or our metrics here in Kern County are well above that for Tier 1. Tier 2, that is the red category, and you just heard Ryan Alsop say that that is the goal that Kern County is trying to achieve. That is the goal that we're trying to get to next. Tier 2, the substantial category, that allows some businesses to reopen and expand services, if you will. A lot of these services that have been going in or from outside only will be allowed to go inside for a minimum requirement or for a maximum requirement, I should say, if we go into the next tier. So our county leaders are trying to get Kern County into the next tier, and then as we go down up to tier 4, those are where the less restrictions are in place. So again, that all comes as we've learned that 94 new people have tested positive for coronavirus. Our numbers in Kern County continue to go down. However, we continue to see a large death rate here in Kern County. No new deaths were reported. As you know, those deaths are sometimes lag. So we should be getting more deaths in the coming days as we progress. But 94 new cases of coronavirus in Kern County today. A little less than half of those, or out of our total, which is just under 30,000, around 15,000 of those cases are considered recovered. So that is definitely some good news. We will have more on these restrictions, these new guidelines that were just introduced on Friday to the state, and how this will impact Kern County coming up today on 17 News at noon. Just a reminder, more information can be found on our website, kget.com. We'll see you back at noon, but for now, I'm Alex Fisher in the 17 studios.